everybody, welcome back to our channel. I'm Dr. Amel from City Skin Clinic, and today I thought we'd have a little chat about what can go wrong with dermal fillers. So this is a really important topic, and you know, the whole kind of ethos of our clinic and this channel is that we have a really open and honest discussion about everything aesthetics and skincare related. And I have always believed, and everyone on our team, we're just really passionate about providing the best information, to the fullest information and the truth about all kind of beauty treatments, medical aesthetics treatments. And then I think based on all of this, we want to empower our clients and community to make the best decisions for them. Part of having that honest conversation about our treatments, which I think are incredible. I think Botox, fillers, non-surgical aesthetic treatments are actually revolutionary in terms of what can be gained, what can be achieved. But also it's really important to explain and to be honest that there is always a risk of something going on. There are potential side effects, there are potential complications, and the important thing is to, you know, speak with people and say, look, this is what could go wrong, and this is how we try and reduce the risk of anything go wrong and make this safe and make sure that you get a great result. If something did go wrong, this is what can be done about it. And then based on that, based on the benefit versus the potential for anything to go wrong, everyone should be free and empowered to make a decision for themselves. I think, you know, if something's, you know, it's your face, if something's going to be done to your face or anywhere else in your body, you absolutely have the right and agency to be able to make that decision. So this is not to scaremonger. This is just really pretty much what, you know, we discuss, but maybe in less detail with our clients in the clinic. And I think it's important to be open in order for aesthetics to really be able to do its best. We need to be open in the aesthetics community about these potential complications. So if you are new to our channel, don't forget to subscribe to this channel. And if you are a returning visitor, welcome back. I will also leave some links that I think will be useful below if you want to find out more about dermal filler treatments and potential complications, just to help you kind of do a little bit of background. If you have any questions about anything in this video, please leave a comment below. I will answer it. So what can go wrong with dermal fillers? So dermal fillers, if you've been following our channel, they are, so when we refer to dermal fillers, we usually mean hyaluronic acid dermal fillers, but there are other types of dermal fillers that can also be used. And these are generally used in aesthetics to do things like restore lost volume in the face. They can help fill out wrinkles, they can help sculpt and snatch the face, they can help do things like reshape lips and noses, fill under eye hollows, a whole host of amazing things, even kind of regenerate the hands as well. So they're fantastic. But they are also, these are injections that go into your skin, and the depth depends on the type of filler and what effect is being produced. So, you know, this is not a cream you apply on top of your skin, and obviously there is a potential for things to go wrong. I'd love to chat to you guys about that potential for things to go wrong and how that can be minimized. So first of all, you know, with anything that goes into the body, hyaluronic acid fillers are no exception. There's always a risk of allergy. So this is when your body doesn't like something and it mounts a reaction to it. And allergies can be something as, you know, anything from sort of redness or kind of itchiness in the skin, in the area where that product made contact, to a full blown on, you know, anaphylactic shock where you get face swelling, throat swelling. I know it sounds extremely scary, but it is scary, and it's important to mention that. These allergic reactions that I've mentioned are kind of immediate, early ones that happen straight away. But there are also delayed reactions that could happen much later. So everything seems fine, and then after a while your body, usually in the case of fillers, when they've been there for a while or they start to degrade, then there can be a reaction to them. And in that situation, normally you'll get swelling, you might get warmth, you might get skin changes, you might get lumps and nodules. So it's important to kind of be aware that these can happen. By no means are these allergies common, but it doesn't really make a difference if you're the person that suffers from something where there's a risk of 1 in 10 or 1 in 100, 1 in a million. If you're that one person, it doesn't really matter to you if something's rare or not, right? So it's important to approach it with that mindset. How can you reduce the risk of allergy to fillers? Well, number one, type of filler. So fillers that contain collagen, and these are terribly out of fashion, but fillers that contain collagen, which is derived from an animal product, are far more likely to stimulate an allergic reaction than fillers that are hyaluronic acid, which is not made of animal products. So that's one thing that you always have to think about, is what type of filler is being used. The other thing that can help figuring out whether you're likely to be allergic or not is also, are you someone who have you had an allergic reaction to fillers or hyaluronic acid if you're using hyaluronic acid dermal fillers in the past? If the answer is yes to that, then there is likelihood that you will be allergic again to a hyaluronic acid dermal filler. So it's really, really important to sort of go, without a shadow of a doubt, see a medical professional who is experienced and trained in doing these treatments, who can assess whether there's a risk of you being allergic to dermal fillers. The other thing that in terms of allergies is, even if it's no to all of these and you're not someone with a background of multiple allergies, so sometimes if we have someone in the clinic and they've had allergies to a lot of other stuff but not dermal fillers, they've never had those before, we are more likely to think, okay, there is a greater chance in that person being allergic than someone who's never been allergic to a thing in their life. And we keep that in mind when we are deciding whether a treatment is appropriate with them, and also in terms of observing them during the treatment, after the treatment, following up with them. The reason it's also really important to go to somewhere that is a medical clinic for your dermal filler treatments is they're going to be people experienced in dealing with allergies there. So there will be, in our clinic, all of our staff have training in how to deal with allergies. We have protocols about emergencies, including allergies. We have our allergy kit that includes medications like even an EpiPen should the worst ever happen. So you need to be in that situation where you have people kind of who can help decide whether actually, are you likely to be allergic? If you are, is this even worth carrying out for other alternatives that might be safer? And if everything is fine and you proceed with the treatment and there is a little allergy or a big allergy, they're going to be medically trained people that will take care of you and make sure that's all fine. So that's one really important thing. In terms of delayed reactions that I mentioned that can happen weeks or months later, again, here is where something like using a biodegradable filler like hyaluronic acid dermal fillers is really important. Firstly, the risk of this sort of thing happening is much less with these fillers, but should it happen, you can dissolve with hyalase, an enzyme can dissolve that filler, it can be injected into the skin, and then depending on what the reaction is, maybe taking medications for a few days afterwards to bring down and suppress that inflammation. So again, there's a pattern that's important. The type of filler, the product used is important, but also someone with the medical know-how and the support to be able to deal with it. You can't, with all the best will in the world, you cannot predict what's going to happen in the future, but you can plan and safeguard against it. And that means being taken care of by the right people, not just the immediate treatment, but later on. So that's kind of from an allergy point of view. And then I want to mention after that is something infection. So anytime you inject the skin, you're breaching the skin's barrier, and there's always a theoretical risk of infection. That goes for dermal fillers, it goes for Botox, it goes for an injection of medication, it goes for a vaccine, anything. You're breaching the skin's protective barrier. But thankfully, infections in these scenarios are usually not common, not in a medical setting anyway. How do you reduce the risk of this? Well, for example, in our clinic, everything is sterile. All of our products are, premium products. They come directly from the manufacturer or the pharmacy that the manufacturer allows to distribute it. And nothing is opened until we're ready to treat the patient. You also do things like cleanse the skin with a prep solution to clean and sterilize the area before injecting anything. When you're injecting, you're using needles that have just been opened for that specific purpose in that moment. You're not touching anything with, other than the skin with the sterile needle. The syringe itself is sterile because with a filler, you just open it the second before you're about to do the injection. If you do an injection and you stop to look back and then you go back again, your needle and your syringe go into a sterile just container to hold them whilst you're shaping or you're massaging the filler. Again, in that environment, everything has to be aseptic. In the same way that if you went and had an injection, a vaccine, any sort of medical procedure, you need to have an aseptic process that makes sure that everything is nice and clean. The other thing is, after the injection, we clean the area. Once again, we apply a barrier to protect it so that you don't have this entry point, open to the air for anything. We advise patients on when they can touch their face, when they can wash their face, just to keep everything nice and clean and sterile. And then obviously the filler itself is sterile because the syringe is just opened the minute that we're about to inject. So this really helps with this process and it helps keep everything clean. Following on from that, you of course then we advise our patients what to look out for after a treatment, what's normal, what's not, and we encourage people to reach out to us if they're not sure about anything. Normally signs of infection are pain, redness, swelling, so these are things we tell people to let us know straight away if it ever happens, and then you can treat it. So again, this is how we keep people safe, and this is how any reputable provider of non-surgical aesthetic treatments keeps people safe, is having that process. And then again, if the worst ever happened and there was an infection, you need to be able to get a hold of someone, to have an urgent follow-up appointment, to be able to be given antibiotics if there's an infection. So all of these things really, really matter. And it's super important to be able to get the help you need if it happens. So again, plan for the worst, and then you'll avoid the worst happening. So this is how we kind of deal with making sure that we minimize the risk of infection and then minimize the risk of allergies. Another thing that can happen with fillers is you get lumps, and these lumps can appear either straight away or they can appear later. So the lumps that appear straight away, it's usually because the filler is too superficial or there's uneven distribution of the filler. The good news is these are very easy to solve. You just need to come back to a clinic and they can massage them down to the right position for you. The way we avoid these in the first place is by injecting at the right level. And so again, if you're seeing someone for dermal fillers, you want to know that they're experienced in this area and they've done these procedures for quite some time. So they, it's like anything in life. If you have a lot of experience doing something and doing it regularly, then you're going to have fewer risks and side effects that happen. There are lumps that can happen later on, so when the filler starts to degrade, you can get lumps, and these are called granulomas. These are slightly different. It's your body reacting to the filler as it degrades. That's what we think. And in that situation, again, the first port of call, you should always be have your treatment somewhere where you can reach out. Whether you had the treatment yesterday or a year ago, you should be able to reach out to someone and say something's wrong, and they bring you in. if that ever happens in that scenario, you should be able to go in, and normally there are things that are done, provided it's a good quality filler, it's hyaluronic acid. There are things that can be done to reduce these lumps and treat them and make sure everything's fine again. And things like asymmetry, again, asymmetry can happen anytime you have any treatment, particularly dermal fillers. And so being able to go somewhere where people are experienced enough to take into account that this is how we're going to avoid asymmetry. And if you're someone like most people in the world who already has a little bit of asymmetry in their face, you need your initial treatment to take into account that asymmetry so that it's not made worse, and in some cases even corrected if it's something that you want corrected. And then, other things that can go wrong with filler, so I'm kind of moving towards the more serious things. And it's things like, persistent swelling. So that's particularly happens if people use the wrong filler in the wrong space. So we often might see that in the under eye area. If someone uses a filler that's not appropriate for that area, then you can end up with persistent swelling. That swelling may be resolved by dissolving the filler, but at the same time that swelling could also stay and be persistent for some time even after the filler's gone. And so again, the way to reduce that is by using the correct filler, by injecting it in the right area, by acting early should there ever be any swelling to correct it. And then, some of I'd say probably the worst potential side effect of filler is actually, and this isn't a side effect, this is a terrible consequence that could happen, is if the filler injected into the wrong area of the skin and manages to either compress or get into a blood vessel. That's called vascular occlusion. So if it blocks an artery, and particularly if that artery supplies that area of skin. So in that situation, if someone doesn't act enough, then you could end up with compromising the blood supply to the skin, and that can end up eventually with loss of tissue in that area. So the skin dies, you can end up with an ulcer, and then scarring or even surgery is needed. So it's a terrible, terrible scenario. This has never ever happened in our clinic. I just want to make this clear, but it is something that every single patient who's having dermal filler, it doesn't matter where, we always go through it with them as a potential complication. And we always explain this is how we reduce the risk of this happening. So number one, using the correct filler. Number two, in areas where they are especially sensitive, such as the upper face around here, we will use microcannulas. There are certain areas such as the nose, we will inject to a certain depth, so quite deep down, and we will avoid certain areas even if the patient really wants those areas treated, because they're just too high risk. And be in such a high risk area, you want to be really, really selective about the patients and make sure that this is a treatment that when it's done, it's necessary. And again, injecting into the correct level is important. So if you know your anatomy, you'll know which areas have blood vessels and which layers are safer to inject in. Again, careful and slow and deliberate injections, that helps reduce the risk of this happening. Doing things like drawing back as well will help. It is, it's not, there's no one thing that you can make this safer. It's a whole collection of things that starts with the person doing the injection, being experienced, being trained, and also making sure that that person is able to handle any potential consequences if anything like that happens, like needing Hyalase, and like an emergency referral and transfer. So these treatments are amazing, and we do them to look and feel better, but we have to be honest with our patients that there are some risks with them, and that's why I do these videos, and we have a blog, and we have this conversation with our clients in the clinic, because it's really important that you know what the potential risks are and how these can be mitigated so that you can get the best results always. I personally think the most devastating potential effect of injecting filler in the face is obviously blindness. Thank goodness this is extremely rare. and there are only there's sort of just 100 cases in the world, but to be honest, 100 cases is 100 too many, because it is still such an awful potential risk. With the blindness, like I mentioned, it's not just kind of the glabella, but so the forehead, or injecting filler in this area, or injecting filler under the eyes, but potentially filler injected anywhere in the face could carry this risk because of the blood supply, and that's why I tell everyone, treat every area as particularly sensitive and important. Again, the type of filler is important. So in the cases that have happened with blindness, it's not just hyaluronic acid dermal fillers, but there's a greater risk with fat grafting. So when they take fat from one area and inject it into the other, there's a risk of blindness with that. And also the type of filler is important. So injecting filler at a high speed, particularly thick filler, is more likely to be associated with these problems. So again, using the correct filler for the area, using the right technique, and knowing the anatomy and being experienced enough to monitor and to administer the treatment makes these treatments a lot safer. And then things like in high risk areas, we will often use either micro droplet techniques, or most likely use micro cannulas, which are blunt, and if used correctly, they push blood vessels out of the way rather than skewer them in the way that a needle does. So again, that's a really important way to reduce the risk of this. And then other things that can happen that are less scary but are more likely to happen if you have dermal fillers injected is bruising. So even in the best hands in the world, there is always a risk of bruising. If you're someone who's more prone to bruising, you're more likely to get bruising with filler because it is an injection at the end of the day. Things you can do to reduce that, and we do to reduce that, is again by knowing the anatomy, avoiding areas that are more vascular, and in areas that are very vascular, maybe using a microcannula. But even with the best will in the world, I always warn people there is a small chance that you will get bruising, and the things that you can do is, you may have to use makeup to cover it up. These days we're all wearing masks, so if it's an area covered by the mask, that's easy. But this is why, again, one of the reasons I recommend, if you're getting dermal fillers before an important date like getting married or a really big event, then have them done sort of 4 to 6 weeks before that event, just to make sure if there's any bruising or any problem, it all settles down. And then another thing is swelling, and that again depends on the area and it depends on the type of filler used. So when we're using thick filler that attracts lots of water, there is a greater chance of swelling. So the jawline is a really good example of that. And so that's something I warn people about. Lips can also swell quite a bit. Again, the swelling is something very transient, very temporary. You can help bring it down with ice. You can sleep with your head propped up. So these are ways to reduce it, but it's just something to warn. So if you've got a photo shoot the next day, please don't have lip fillers, don't risk it. Last but not least is something that's not so immediate, but it's something that has to be said, which is kind of having distorted appearance. So sometimes if people have fillers and they maybe lose sight of themselves and their appearance, and you can end up drifting to a really unnatural looking, and in my opinion, a less beautiful version of yourself. This is something that you can see more often, firstly in people that kind of hop around between different places, and so there is no one that has a record of how they looked before they started, how it started, how it's going. So in our clinic we have these kind of really long-term relationships with our patients, and so if someone's been with us before, our doctors will have a look at their photos and their last strips, just to make sure that every time we're boosting and enhancing rather than taking away. And if you start at a baseline where you just want to improve on what you have but also look very natural, you're not going to go wrong. Other things, and this is again important to see a medical practitioner in a setting, is there's a duty of care there. So as a doctor, even if someone is coming to have fillers for purely aesthetic or cosmetic reasons, you know, you just want to make your lips a little bit poutier, a little bit cuter, that's completely fine. But I have a duty to make sure that that is what you get, and you get it safely, and that I don't, you know, do anything that makes you look worse, if I'm being honest. And so again, you have to have, your practitioner has to have your interest at heart. This is a partnership. There's a lot of trust that you put in your practitioner, and they need to be able to repay that trust. So, you know, again, a medical professional has a duty of care, and that's important, not just to make sure that things go right and handle when things go wrong, but also to put your welfare above them wanting to do a treatment on you. And sometimes that means being honest, and we've done this you know, many times in our clinic, and saying, I don't think this treatment is right for you. If we see someone who's had fillers elsewhere and they've had too much and they want more, we will gently sit down with that person and say, this is not in your interest to have any more filler. And, you know, we've done this, and actually it's happened, you know, thankfully not too often that we've had to say this, but, you know, most people, when it does happen, you know, they seem quite respectful of that fact. Sometimes people don't like it, and, you know, we've even had one negative review from someone who was so unhappy that we wouldn't do any lip fillers on her because I didn't think it was appropriate for her to have more treatment. But, you know, this is just what it has to be. This is a really important relationship, and one of trust, and you have to have someone who's looking out for you and who's got your back. Other things that we look out for is someone who's having filler, but maybe they're not in the right space for it. So that can be things like body dysmorphia, where someone wants to change themselves and loses sight of what's actually there. So they may be really fixated on one, you know, on their nose, and think it's the worst thing in the world, for example, and actually that isn't reflected by reality, or they just are unhappy consistently with their face and their appearance. They want to keep changing it. So in that situation, again, it's about having a gentle and honest conversation with someone. Or there are times when someone wants to have a treatment, and I think the treatment is appropriate, but I don't think they're in the right stage in their life. So I've had a patient who, for example, had just experienced grief. She wanted to do something, and I kind of spoke with her and said, look, I think, you know, this is appropriate for you, but I just don't think you're there emotionally right now to have a treatment. And also, I always advise people that pretty much, you know, 99.99% of the time, nothing, you know, everything will be fine, you know, in our hands. And there's always a small chance something may go wrong. And if you've already got a lot on your plate, like a bereavement, you're going through a difficult period in your life, having something go wrong, even if it's something like a lump that we can massage down, or some swelling or bruising that stays, it's going to make you feel more miserable. So again, you know, in that situation, I'll say, why don't you go and work on this? We're here. The consultation notes are here. When you are ready and up for it, and you've kind of gotten over this really difficult patch, come find us again, and we will revisit this. And if all's good, we'll do the treatment. And that works really well. So I think, you know, I'm sorry this video is a bit long, but I think it's really, I just wanted to address some of the main problems that can go wrong with fillers, and just pull you guys into it, because I think having these honest conversations, you know, nothing in life is not risk-free, and certainly dermal fillers are no exception. But how can we make the treatment safe? And even if, you know, you understand the risks, and you understand there are ways to make it super safe, but you know, it's still at the end of the day up to you to decide, are these risks worth it? And no one should be making that decision on your behalf. So to end on a slightly cheerier note, you know, like I said, there are risks, there are ways to reduce them. everything begins and ends with having an honest, detailed consultation, and being able to ask all the questions you need. And if you have any questions about things that can go wrong with dermal fillers, please leave me a comment below. I also check out the links to our website with a bit more information. If you haven't already done so, please subscribe to our channel. Don't forget to give this video a thumbs up. Until next time, stay beautiful.